Good afternoon, Vallejo. This is VCAT, Vallejo Community Access Television, your hometown television station. This is Community Forum, and I'm your host, Maria Bitagon. You can watch us at Channel 27 at Comcast and Channel 99 at AT&T Uverse. We are recorded on Thursdays and Sundays at 6:30 p.m. I am so happy today. I want to welcome someone from the Area Agency on Aging for Napa and Solano. I want to welcome my guest today. She's Elaine Clark, our project manager for Area Agency on Aging for Napa and Solano. Did I say that right? Thank you.
Very good.
Okay. I am very excited about you coming here. I just turned 80 and I am so interested in getting so many information for myself. But I guess there are some other people who are in my age group or who are in my particular predicament. So I am going to be so happy to get all the information from you. So would you like to introduce yourself and what you have been doing first so that my introduction, if it's not sufficient, will be, sufficiently augmented?
Very good. Sure. So the Area Agency on Aging is an organization that focuses on the needs of the older adults in the county, both Napa and Solano County. And in January, Solano County became the holder of the agency. So I started in January 14th to lead the agency so that we could understand what the needs are of the older adults in the county and look to the future to see and understand what those needs might be and advocate for more funding and more senior services. While we're doing that, I'm also then engaged in trying to understand what the needs are in the smaller pockets within the county, and then also look at the funding sources and distribute that out to the service providers. So my background to get here is that I ran a large nonprofit older adult service organization in Contra Costa for 7 years. And so I've used all the programs, I've worked with different providers, and I've built coalitions. So one of the things that I want to do here is build coalitions. So we're just getting underway.
Okay, so I know that it's very important. I know that it's important for me, but because you are a different age group, why do you think it's important?
Well, I'm not that different. But for the older adult population will continue to outpace every other population group till at least 2030.
Okay.
And the folks 80 years and older is the fastest growing segment of the older adult population.
Oh, wow.
And until 2050, we anticipate that there will be, for the first time ever, more middle-class, middle-aged folks with both their parents alive than in any other time in history. So we've got this huge influx of younger, older adults, 60 to 70, and that is going to continue to grow.
Yes.
While the older population, 80 plus, will more than double. So we have to look at both younger folks and older folks and understand what the different service needs are. This is completely new. And right now there are 130,000 older adults 60 plus in this area. That will for sure double, maybe triple in the next few years. So we have to be ready. We have to understand the needs and then what the needs will be and how do we serve those folks.
Okay, so I have two questions,
Sure.
one after the other. How is the aging population changing in Solano County, and how will you address the changes?
Yeah, so again, the growing number of people.
Yes.
I just left a meeting this morning talking about transportation.
Yes.
Never before have we worried so much about transport. How are older adults going to get around? For example, the average person outlives their driving age by 7 to 10 years.
Mm-hmm.
So if that's the case, what are the transportation needs? And are the transportation needs different in Vallejo than they are in Benicia? And are they different for an 80-year-old than they are for a 60-year-old? And how do we put all that together? So as far as how are the changing, what are the changing needs, and how are they affecting people,
Mm-hmm.
individual? We have to remember that these are individual people. So we have to look at that and then understand what services are available and what's not there, and then with the funding that I have, how can I address that, and how can I build coalitions of other people to bring in so that we can create comprehensive program areas that's not just relying on one funding source or one organization. So it's quite a task.
Yeah, it's quite a task. It's complicated. How does the work of the Area Agency on Aging improve the health of seniors? That's very important to me.
Good. That, and everything we do, people say, oh, it's just a meal.
Yeah.
For every $25, this is a national study by Mathematica, for every $25 invested in Meals on Wheels, for example.
Yes, Meals on Wheels.
That, on a state level, that reduces their number of people in care homes, care facilities, by 1%.
Oh.
For every $25. So people are healthier.
Yes.
People are able to live at home if we feed them,
Uh-huh.
right? And if we do a wellness check to make sure they're okay when we give them their meal. Those are health benefits. The other thing, I just was in a meeting and I was listening about this transportation, and all of this money regionally is available, and they still can't figure out, this group of people who've been working on this program for years couldn't figure out how we get it down to the individual older adult that can't drive, that needs to get to their medical appointment. So my being in that meeting, I said, wait a minute, I've got some money.
Yes.
If somebody will do a contract that I can fund, that will be on-demand rides for a low-income older adult, or any older adult, really, that needs to get to a medical appointment and back and can't drive and has no support system.
Yes.
I can fund that.
Okay.
So let's put the structure together. That keeps people healthy. So there are lots of things like that. I'm learning that we can, with our little bits of money, we can fill needs, we can fill pockets.
That is so great, because by you going out there and telling them the information, and that when they get informed, they know what to do. So what is the Advisory Council on Aging?
Yes.
And how can people get involved? I know that you as a project manager with your people cannot do it alone. We have to work together. And so how does that work?
It's a really good point. I can't do it alone.
That's right.
Right? And so, and unless I go out and I listen to people and I hear and I understand, I don't know what's needed. And I'm only one person.
That's right.
So it's really great that when the Older Americans Act, the federal act, was set up, they said there will be local area agency on aging set up, and they have to have a council, an advisory council of people that live in the community. So we're setting ours up right now, and there are 16 people, 8 from Napa County, 8 from Solano County. They will be announced next Tuesday or Wednesday, so I'm not going to tell you who they are.
Okay. It's going to be formally announced.
Yes, it will be because the board of supervisors, we put forth the names of some folks, and they have to approve them.
Yes, right.
And so then what will happen is this council will meet every month. In fact, we're going to meet on the first Tuesday of every month, and we're going to meet in Napa and Solano counties, and we're going to set up work groups that will address fall prevention, that will address advocacy work, transportation, all kinds of living communities. So all kinds of issues that the council wants to address and work on and come up with solutions, and then as a group that will bring more ideas to the table. So this council, they will be voting members. However, the working groups will have people from the community as well. So we're really trying to engage a whole lot of people. And we're going to be building that over the next couple of months.
Yes, when you were our speaker, at the Senior Coalition, you told us that there's a difference between the old AAA and the new AAA. Could you please, how is the old AAA different from the new AAA?
Well, the former AAA, Area Agency on Aging, was a nonprofit.
Yes.
And as a nonprofit, you have to raise money, you have to...
You do everything.
You do everything, right? And we are part of the county.
Now.
So we don't have to worry about the fiscal issues, right? So we have fiscal oversight. So that's the first thing. And we have a team of people both at the county level, both in Napa and Solano, that are helping to make this work. It's really a great support system. So that's the first thing. The second thing is the Area Agency on Aging's focus should not be providing services. We should be understanding what the needs are and finding local providers that can provide those services, and then propping them up and helping them be successful and grow. That's a different philosophy, I think, than the previous, AAA. We can help and do so much more if we're not also trying to do the services ourselves.
So, so the difference is funding.
It's funding and it's structure, and it's the philosophy that other people, other organizations, there are very good organizations out in the community that can do the work better than we can.
Okay.
So we want to help those folks be successful.
Yes. So what types of services does the Area Agency on Aging fund? You have mentioned a few.
Right. It's quite a range of services. So the Older Americans Act was very specific about the types of social services, and one of them is meals. It's nutrition, senior nutrition, and that is about almost half of our budget goes to home delivered meals and congregate meal sites. So at the senior centers, for example, there are some creative ways we can enhance that looking forward, but we have to get people fed, right? So that's one thing. And then the other, there's another set of funding that's for disease prevention. That I would like to use more towards fall prevention and creating a regional strategic plan, and then finding additional funders to help me support a large range of services to prevent falls, which are one of the leading causes of unnecessary hospitalizations among older adults, right? So that's one area. And then the other area is family caregiving. Family caregiving, 66% of women will end up taking care of someone else. Right? And the women that do that spend 50% more time for a longer period of time than a man would. So these are some serious statistics. So what happens when you do that? You need support. Most of the time you don't know what you're getting into, right? It just happens. So, and you need respite. You need a break. You need, and now we're finding out that the growing group of folks are taking care of their grandkids and older in life, right? And so there is support money that I have to help with that, and education and outreach and respite, and if somebody's taking care of someone, and it would help to have a grab bar, for example, I can pay for that. I have organizations, so I have money that I can send to an organization to pay for that. So those types of support systems are really important.
It's really nice to know.
Yes.
I would like to also ask, because when they get older, they have less, funding, and most important of all, if they want to live at home, can they get any assistance for rent or can you give, or are there organizations that actually service these people who needs to pay lower rent, rent that they can afford?
Right. So this is the big issue in our state and in our country, right? Is housing. So we don't specifically have housing money. What we do have, we do fund legal assistance, free legal assistance for folks that might be having maybe a tenant-landlord issue where the landlord is doubling the rent next month
or increasing.
Yeah. So we have, somebody could call our legal assistant and talk with them, make an appointment, and they could help them with that issue. Yes. So that's one of the things that we do. The other organization that we fund is the Ombudsman Program, and they are advocates for folks in care homes.
Yes.
So again, you have a lot of those increases and a lot of other issues in the care home. So we work very closely with the Ombudsman for that.
That's great.
Yeah.
Yes. So we normally look at the program and then we want to measure the success, because so how will the area agency on aging measure success?
Great question.
How? That's,
Yep. So it's interesting because in government work,
yes,
they want to measure outputs, widgets.
Yes.
How many, right? How many? I come from a nonprofit background where for my organization we transformed ourselves and said, if somebody says for the contract what you have to do is serve 5,000 meals, say, I would ask my staff, so what? And they said, well, what do you mean, so what? And I said, what do you care that you serve? What is the outcome of serving that meal? Right? Is somebody healthier? Are they able to live at home? What's the outcome? So this first year, as I'm getting things in place, we're still looking at units served and the people served. We're going to be transforming that. My providers don't know this yet, so this is breaking news. But I am all about outcome. I will include in the future outcome measurements. So I'm going to demand that our providers show me, is somebody healthier as a result of the service that you're providing? Are they able to live at home? Show me the data that shows that they are able to live at home. Show me the data that they are less isolated because of the visiting program that you're doing. That's going to be rolled in later.
Okay, so April 22 in American Canyon, there is a public hearing on the area plan update. Can you tell us?
Sure.
Can you give us the news?
Yeah. So every 4 years, the area agency, we have to create.
And this is Napa County. American Canyon is Napa County.
It's Napa County, but we've already had one meeting in Solano County, one in Napa, and so this one is really close to both.
Yes.
Okay? That's why we picked this American Canyon. We have to do a 4-year plan.
Okay.
Looking at statistics of the population and the services and do needs assessment. So every year during that 4-year period, every year we do an update. We do some more research, we look at the data, and then we take that update to the community and say, this is what our plan is for next year and this is why. And we get feedback, and then we incorporate that feedback into the final plan. So April 22nd is the last community meeting.
That's great.
And so we will be taking that final information and creating our area plan out of that.
So they're talking about this master plan on aging proposed by Governor Newsom. What are your thoughts about this master plan on aging?
So for the first time ever, any state in the country, the state is saying, we have this massive number of people,
old people,
Yeah. And I didn't want to say that.
I can't say it because I'm old. Okay.
And we don't have a plan. We have no idea how to tackle this. So for the first time, Governor Newsom has said, we need to take a look at this and we need a master plan. And he has put resources behind it, he's put people behind it, and they're starting the work. The good news is we have a lot of people involved and a lot of data, and it gives me hope that they will integrate some systems. Right now, nobody's talking with anyone at the state level. Everybody's siloed, and they will break some of those, and they will come up with, gee, we really need to move in this direction. And I think more funding will come to the local organizations such as ourselves in the next 3 to 5 years, yes, as they recognize the health benefits of allowing people, giving people the support systems that they need to live at home for as long as possible.
Yes.
So I'm very excited about this master plan.
Too. So if there is anything that you want to say to the Solano or the two Solano County and Napa County, if there is anything that you want to communicate to them, could you please give them the necessary information?
Sure.
And also what they have to do, because you cannot just do it by yourself. We have to help you accomplish what you want to do for us.
Right.
So would you please appeal to them so that they will have a knowledge of how we can be effective and how our coming together will make this program be a better program for all of us.
Thank you.
Thank you.
Yeah, so it's a collaborative. No one person can do this alone. And it's going to take time. And it's going to take all of us listening to each other. I might have a great idea that you think is horrible. We need to work together and be willing to communicate and collaborate and understand that there's no one way to get this right. So I welcome everybody. Please come together, tell us what it is you need, tell us what the issues are, and we will listen. And we want you also to participate, be part of the advocacy work that we're doing. And because again, there's so many people on a council, but we have work groups all over the place. So let's bring everybody in these work groups and get as many voices as possible.
So could you please also advocate for the Senior Coalition to attend meetings there so that they can get the information that they need? Because the Florence Douglass center, we don't want to say it's senior center. It's a center for everybody who wants to feel young. And so that's what our executive director wants to know, that everybody, is, no matter what age they are, welcome there. And so I would like you to give some information about you, how to get in touch with you, and what is the actual avenue of of addressing the issues.
Sure. Anybody that wants more information can give me a call. The number will appear later on the website. It's on my website, but it's also, I think, going to be run,
yes,
right? So, and the website is www.aaans.org, so napasolano.org. But please, just give me a call. I love speaking with people, and ask me to come to your meetings, your events, and I'd love to tell you more and listen to what your needs are. I'm really, really happy to do that.
Would you like to give your telephone number to that?
You can call my number at 707-784-8792. Thank you.
Okay, thank you so much. Thank you very much for being here, and thank you very much.
Thank you.
And whenever you want to come and address again this issue, if it's for the good of the people of Solano and Napa, we're here.
Fantastic. Well, October is Fall Prevention Month, so I'm hoping to have a strategic plan by then for falls prevention. I would love to come and talk to you about that.
Thank you.
All right.
Thank you so much for coming.
Thank you.